and welcome to Doc Talk. I'm Tara Perre, Race Director with the Community First Fox Cities Marathon presented by Myron Construction. Doc Talk is back, and this is your chance to ask our medical experts questions about training, sports injury prevention, whatever's on your mind as you're getting set to train for our races. And I want to shout out to all of our sponsors of this. We have Ascension, Theta Care, Orthopedic Sports Institute of the Fox Cities, and orthopedic and sports medicine specialists. And joining us today is someone from our last sponsor that I just mentioned, Dr. Will Albiero. Welcome.
Thank you very much, Tara. Thanks for having me. Excited to be here and answer a few questions.
Wonderful. We're happy to have you back. So Dr. Albiero has said he wants to talk a little bit about shin splints, and I know that's a common question that people have. So maybe let's just dive in. First of all, what are shin splints, and maybe just give a little background on that.
Sure. Yeah, shin splints are it's a very difficult problem in that it's common. We don't know exactly what brings it on in what type of people and what type of runners. We have a few ideas, and it's one of those problems that takes time. So shin splints, by definition, the medical term is medial tibia stress syndrome, which is essentially an overuse problem of the lower leg. So the muscles and the compartments of the lower leg that make up kind of the calf region as well as the front of your shin, when they're overworked a little bit too quickly, whether that's with some of the common conditions are jumping into training too quickly, increasing your training at a pace or a rate that your body's not ready for, changing some of the terrain, all of a sudden you're running more hills, or coming back into running or other sports after a prolonged period of rest. That's the most common time that shin splints will affect somebody. And what it is, it's an overuse of the muscles and tendons around that lower leg. So those muscles and tendons are surrounded by fascial compartments, or essentially these thin layers. You can almost think of it like a tight balloon lining. And when the muscles get activated and they get blood flow, sometimes it can stress those linings, and that can be a pretty painful problem. And it's a tough problem because there's not often a quick solution. A lot of times when we have an injury, particularly in athletes or in runners, you're looking for a quick fix to the issue at hand, and that's just not what shin splints are. There are a few ways you can help treat the pain or the discomfort immediately. If you're looking for that acute care, which would be anti-inflammatories, obviously resting or stopping the activity that's causing the problem, ice treatments, different types of massage, and some types of therapeutic exercise can be helpful right away to calm down the irritated shin splint or the soft tissues. But really the primary treatment is over the course of weeks to even months, and that means giving your body a period to rest. That doesn't have to be shutting down your running altogether, but it can mean making some modifications to your running habits. So cutting your running routine, your distance down, cutting your length of time running down, changing the surfaces that you're running on. So that's one thing I often tell patients when they ask, I want to keep moving. It's not severe enough for me to stop my training altogether, but it's irritating. I can tell this might become an issue if I keep pushing it. And one thing I say is try and find a local track, one of the synthetic surfaces where you can, instead of running on hard pavement or asphalt, go to that track surface and run your laps, or even a nice soft terrain like a trail that doesn't have a lot of up or downhill, something like that to offload the soft tissues of the leg. Wearing updated or well padded shoes. You don't want to wear running shoes that are way too thick of padding. That's not great for running either, but something that's not 600 or 700 or 800 miles into your running routine, rather a good healthy pair of comfortable shoes. There are definitely certain stretches and activities that can be helpful, keeping that Achilles tendon nice and loose, keeping your cord floor muscles as strong and firm as possible. All these things can help minimize the effects of the shin splint type discomfort. There are some things, there's a differential diagnosis, or some things to think about when someone comes in with a complaint of shin splints. That is definitely the most common reason for that pain in the shin area, but there are some other concerning things like a stress fracture or a very irritable tendinitis, or even a tendon or muscle injury in that area. Those things aren't as common, but I think they're important to keep in mind. So if you have a bad case of shin splints that is progressively worsening, especially if you're doing the right things, a lot of the conservative and simple treatments that or been told, it might be worth it to get seen at least by your primary care doctor or some professional to say, hey, is this just shin splints, or is it something more severe that it could be making significantly worse, like a stress fracture? And an
Yeah.
X-ray and other types of advanced imaging can rule that out pretty quickly in the event that that we're concerned about it. But it's a tough problem. It's often a transient issue. By that I mean it comes, it hangs around, and then it tends to go away with appropriate treatment and rest. But it takes patience. And this is not one of those injuries that's a no pain, no gain type of thing. You have to give it the appropriate time and listen to your body, and ease yourself back into running or whatever else it might be that you're trying to get to. And especially with training for a marathon like that's coming up or any kind of long distance race, that's when we see people suffering from it the most.
So if they're having this issue, it's prolonged. They're doing, they've cut back, they've made sure their shoes are great. They're maybe running on the track, like you suggested. Is there maybe some cross training that they should be working in with that to help with, maybe taking the focus off so much on the running part?
Absolutely. And that is a fantastic question. Cross training is one of the best things you can do as a runner and as any kind of athlete or person who's trying to be active for so many reasons. So one of those reasons is dealing with an injury. When you have an injury, often people think, especially an overuse type problem, well, now I have to stop that activity and my working out altogether. And that's a really frustrating thing for a person because you'd think, okay, that might be the solution, but I need to stay fit. It's good for my health, for my weight, for my mental sanity. And it can be really stressful, and it can cause people to get depressed or angry, and it can affect your daily life and how you handle things at work and at home. So to bring that all back to cross training, that's a really good way to keep yourself active while not stressing the injury at hand. So, and that's why I'll kind of dive into cross training a little bit, if
Yeah,
that's
that'd
okay.
be great.
Again, that's one of the reasons to do it, is so that in the event you suffer an injury, that you have something else to keep yourself active and fit. But even if you don't have an injury at hand, two of the important things I think of cross training are to prevent injury, particularly overuse type injuries. If you're constantly, we'll use the example of running, using the same muscles, step after step, motion after motion, you work those muscles really effectively. So you build those muscles and gain strength and make yourself a bigger, better runner. At the same time, you're clearly overusing those muscles. So one important reason to cross train is to use different muscles so that you're not constantly using the same ones, putting yourself at risk of injury. And the second reason, in that more people like to hear this too, is that you can actually become a better runner and become stronger and fitter by cross training because you're using the muscles that you're not using while you're training for running. So lots of examples of cross training. We'll again use the example, if you're a runner and that's your passion and your love, a couple times a week, it's nice to incorporate other things, whether that's biking, rowing, elliptical, even water running, a lot of things, Pilates, yoga, strength training, anything that's just different, using different muscle groups than the typical running routine, that's technically cross training. So a lot of great reasons. Prevent injury, make yourself healthier, fitter, faster as a runner or whatever your passion is. And then in the event that you are dealing with an injury, it gives you a great opportunity to do something else that's not going to affect that injury. Let yourself heal in the meantime. So when you finally get back to the running or whatever your passion is, you're able to do so and not coming back from ground zero.
So is there a focus area of cross training that would be better though for shin splints, or is it kind of like do whatever works for you?
No, great question. So low impact, things that are not constantly putting force through the lower leg. So running on firm surfaces, especially lots of repetitive strikes of the foot, that's what tends to cause shin splints. So things where you're offloading your joints in your lower leg. For example, skiing, like cross-country skiing or skating in the winter, especially being here in Wisconsin, great way to cross-train. Biking, elliptical, rowing, all these things where you're not striking the foot. That's the beauty of cross-training as a runner, is that running is by far one of the more aggressive actions for our knee joints, our ankle joints, for overuse syndromes like shin splints. So really any kind of cross training gives that such a break, gives your body such a break, that they're all pretty darn effective in the running world. So something like box jumps or aggressive strengthening, that might be one that you want to avoid, but most other cross training exercises can be pretty helpful.
So maybe not the time to pick up Zumba or some new aerobics class, but
Exactly.
yoga or swimming.
Exactly.
That sounds pretty much better on those shin splints.
Yep.
Yeah. Okay. Great. And then, you know, I know we talked about what shin splints are and now some cross training ideas for it. Are there ways that people can be preventing even getting there? So like I can just see people out there going, whoa, he just said this is a long recovery time. I'm glad I don't have to stop running, but are there some things I can do to prevent it from even getting to that point?
Yep. Yeah, so first off, making sure you have healthy running gear and particularly shoes. You want to have a set of running shoes that fits you comfortably, that you feel good in. A lot of people ask that question about shoes. You know, what kind of shoes should I wear? That is a big, broad question that has no specific answer. There's definitely a few principles you want to follow, but at the same time, there's a lot of great companies that make a lot of great running shoes. And the reality is, it's whatever makes you feel most comfortable. So that comes with a lot of trial and error. And I think some important things are not just to see what your friend's wearing, get the same shoe, not just walk into a shoe store and pick the color you like best. Maybe not even have someone, even someone who evaluates gait training, if they watch you walk and say, oh yeah, you have this kind of heel strike or in turn or pronation, supination, whatever it might be, not to just go with that, because people run often a lot different than they walk too. So it's trial and error. Try some different shoes, see what feels best for you. A running analysis at a shoe store or running shoe store can be really helpful. Not necessary. You don't have to do that to get started. But if you're wearing a pair of shoes that are not comfortable, they're not comfortable for a reason. It's time to look into something else. So maintaining the appropriate gear. But then when you are training, any changes to your training regimen, do so gradually. And listen to your body as you go. So if you're going to start hill runs, don't jump into running Pikes Peak the next weekend. Take your time, do a few different laps, and listen to your body as you go. Same thing if you're increasing your speed, your distance. That is the most common reason for shin splints, is overdoing it one way or another, pushing your body to a point that it's not quite ready and trained for. So gradually easing into whatever workout routine you're planning on, that's the best way to prevent injury, particularly shin splints and most other overuse type problems.
Interesting. That I just had a flashback to my trackster days, you know, and I think that was probably the reason why shin splints would pop up, because you go from maybe another sport and all of a sudden you're doing totally different movement and you're running a lot more and, you know,
Absolutely.
getting into it too fast. So that's a really good tip.
Yeah, and at some points in our life, we can tolerate that better, right? Jumping between activities more and more. But as we age a little bit, that's normal. Our tissues become a little less compliant, a little less flexible. They need a little bit more easing into it. So you're right. That's probably why you got it then. Me too.
Probably live and learn, right?
Yeah.
That's what these training tips are all about. So I think I'm going to wrap us up today. We've had a great discussion around shin splints, cross training, prevention. I love it. I think this is going to be super helpful for many people out there. So thanks again for joining us. Thanks to everyone that's been watching. You know, feel free to ask some more questions. Maybe we didn't dive deep enough into an area that you want us to address. So Dr. Albiero and all of our other experts are always available for questions, and I will relay them. So thanks again, Dr. Albiero. Anything else to share before we let people go?
No, thank you very much, Tara. I appreciate being here. It's lots of fun, and good luck to everyone that's training for all their upcoming races as we get into summer and fall here. I know there's a lot of folks, including myself. So be safe and happy training.
Awesome. I couldn't agree more. Happy training, everybody, and we'll see you in September.